Have you ever noticed those subtle changes in your loved ones as they get older? Perhaps they're eating a little less, tiring more easily, or becoming withdrawn in ways you haven't seen before. These quiet signs can be easily overlooked at first, chalked up to just getting old. But the truth is, they might be the body's way of sending a deeper message, a whisper often missed until it's almost too late. Passing away in old age isn't always sudden. Sometimes there are warnings months, even a year in advance. Sign number 1, unexplained weight loss. One of the earliest and most easily missed signs that your loved one might be in their final year is unexplained weight loss. Often, this sign starts subtly. You might notice their clothes becoming a bit looser, their face looking thinner, or that they're eating less than they used to. Initially, many families dismiss this as just a natural part of aging, thinking, well, everyone gets like that when they get old. But in reality, unintentional weight loss, especially in older adults, is rarely normal. It's often a sign that the body isn't absorbing nutrients as efficiently as it once did. Muscle mass begins to decrease, metabolism slows down, and organ systems start to weaken. So, why does this happen? There are a few key reasons. Loss of appetite. Many seniors in their final months simply don't feel as hungry as they used to. Their sense of taste changes, food doesn't seem as appealing, and they may start skipping meals or eating very little. This isn't a personal choice. It's often because the body senses it's weakening and stops sending hunger signals to the brain. It's almost as if the body is shutting down functions that are no longer essential for the final stage. Muscle wasting, atrophy. The body has difficulty processing protein, leading to a rapid decline in muscle strength. This makes movement more challenging and increases the risk of falls, which can accelerate overall decline. You might see your loved one becoming noticeably weaker, having trouble standing up or sitting down, or walking more slowly. Underlying medical conditions. Weight loss can also be related to illnesses like cancer, heart disease, kidney failure, or even depression. These conditions can progress quietly before showing obvious symptoms. For example, a small tumor might be developing unnoticed and eating away at the body's energy, or heart disease could be reducing blood flow to organs, affecting metabolism. Families often try to encourage their loved ones to eat more, preparing favorite dishes or adding protein-rich supplements. But if weight continues to decrease despite these efforts, it's a major warning sign. At this stage, the goal shouldn't be to force feed, but rather to ensure comfort, offering soft, easy-to-eat foods and making sure they get enough fluids to maintain quality of life. Remember, sometimes forcing food can cause added discomfort and stress for the patient. Instead, focus on creating small, palatable meals and, most importantly, eating together, creating a warm and joyful atmosphere during meal times, regardless of how much your loved one eats. Your presence and love are what matter most. If you notice significant weight loss in your loved one, pay attention. Their body might be sending a deeper signal, and recognizing this now can help you prepare for what's ahead. Sign number 2, persistent fatigue and weakness. Another important warning sign is extreme fatigue, not just feeling a little tired, but a profound exhaustion that doesn't improve with rest. This type of fatigue makes even the simplest tasks seem impossible. Getting out of bed becomes a struggle, and walking across the room feels like running a marathon. Activities that were once easy, like getting dressed, cooking, or even talking, become overwhelming. This isn't just normal aging. It's the body's way of conserving energy as organ function slows down. The body prioritizes only the most essential functions. The heart isn't pumping blood as efficiently as before, circulation weakens, and muscles don't receive enough oxygen. This is why many seniors in their final months sleep more than usual. They take long naps during the day and are hard to rouse. Sudden crashes. There might be times when they seem okay, but then suddenly become completely exhausted. Difficulty concentrating. Conversations become tiring, and they may withdraw from social activities. The most difficult part is that many seniors feel frustrated by their own weakness. They might avoid talking about it because they don't want to be a burden. Some feel ashamed that they can't do the things they used to, leading them to isolate themselves. For families, it's heartbreaking to watch a once active loved one become frail. But forcing them to be active doesn't help. Instead, the most important thing is to understand their limits, allow them to rest when needed, and make their remaining time as comfortable and peaceful as possible. Create a quiet space, reduce noise and external stimuli. Talk to them gently, whisper warm stories, or simply sit beside them, holding their hand. Your presence, the warmth from your heart, is the most precious medicine. If you notice your loved one sleeping more, lacking energy, or withdrawing from life, it could be their body preparing for a deeper transition. Sign number 3, cognitive changes or withdrawal. One of the most heartbreaking signs of approaching decline is a change in mental clarity. You might notice your loved one, who was once sharp and alert, suddenly starting to forget things more often. They have trouble remembering names, dates, or conversations. Time disorientation. They might not remember what day it is, what month it is, or even where they are. Repetitive behavior. They ask the same question repeatedly without realizing it. Increased confusion. Familiar places seem strange, and everyday tasks become difficult. This isn't just normal forgetfulness. The brain, like any other organ, needs oxygen and nutrients to function properly. But as circulation weakens, cognitive function begins to decline. Some seniors even have moments of lucidity interspersed with sudden periods of confusion. One day, they might seem perfectly normal, but the next day they become lost, anxious, or apathetic. Another painful sign is emotional withdrawal. Your loved one might start talking less, interacting less, or sitting quietly for long periods. It's not that they don't care, but their brain is no longer processing emotions and interactions in the same way. Noisy environments become overwhelming, conversations become too tiring, and eventually, many seniors withdraw into their own world. You might also notice sudden mood swings. Some become more irritable or easily agitated. Others seem unusually calm or indifferent, as if they no longer care about things that were once important to them. For families, this can feel like losing your loved one before they're actually gone. But it's important to meet them where they are. Instead of trying to pull them back to reality, talk to them gently and reassure them. Keep their surroundings quiet and familiar. Remember, even if they don't seem fully present, your presence still brings them comfort. Sing them old songs, tell them happy stories, or simply hold their hand and stroke their arm. Those small gestures of love mean the world. If you notice your loved one acting confused, withdrawn, or emotionally distant, take it seriously. It could be one of the final stages of the body's gradual decline. Sign number 4, changes in breathing patterns. The fourth sign that often appears as someone approaches their final year is noticeable changes in their breathing patterns. You might start to notice that their breathing becomes irregular, shallow, or labored. They might even experience periods of rapid breathing followed by long pauses. This change in breathing rate is a result of the body's reduced ability to circulate oxygen properly. As the heart weakens and lung function declines, the body struggles to maintain a steady flow of oxygen to the organs. This is often why some people near the end of life will experience shortness of breath even at rest. Difficulty taking deep breaths. They have trouble taking deep breaths, feeling like they can't get enough air into their lungs. Cheney-Stokes. Respiration. This is a distinctive breathing pattern, alternating between periods of deep, rapid breathing and periods of slow, shallow breaths, or even temporary cessation of breathing. Increased breathlessness. During sleep, signs of labored breathing become more apparent during sleep. It's important to note that this doesn't necessarily mean the end is imminent. Breathing changes can sometimes last for weeks or even months. However, it's essential to monitor this sign closely and ensure your loved one remains comfortable. You can help them by ensuring they are in a position that makes breathing easier, such as propping them up with pillows or sitting upright. Creating a calm and well-ventilated environment with fresh air and proper humidity. Providing supplemental oxygen if prescribed by a doctor. Sometimes these breathing changes can be distressing, not only for the person experiencing them, but also for family members. Witnessing a loved one struggle to breathe is frightening. However, understanding that this is a natural part of the process can bring peace of mind, allowing you to focus on making their remaining time as comfortable as possible. Talk to their doctor for specific advice and guidance on how to care for and alleviate shortness of breath. Sign number 5, skin and temperature changes. Finally, the fifth sign to watch for is changes in the skin. As the body's systems begin to shut down, blood flow to the extremities decreases and the skin becomes more fragile. You might notice that your loved one's skin becomes pale, cold to the touch, or even slightly bluish around the fingertips, toes, or lips. Mottling. Unusual purple or blotchy patches appear on the skin. Loss of elasticity. The skin becomes thinner, more vulnerable, and tears easily. Clammy or excessively warm skin. Especially in later stages, the skin may become clammy or unusually warm. This reduced circulation is because the heart is no longer able to pump blood effectively, and it signals the body's transition into the final stages of life. Additionally, temperature sensitivity becomes more pronounced. Your loved one might feel cold even when the room temperature is comfortable, or they might become easily overheated. This can cause discomfort, but there are steps you can take to manage their comfort. Keep blankets or warm layers readily available to use when they feel cold. Maintain a comfortable room temperature, not too hot or too cold. Monitor their hydration status, as dehydration can contribute to skin problems and temperature sensitivity. Ensure they are drinking enough fluids, or receiving IV fluids if necessary. These skin changes can also be accompanied by general discomfort. Sometimes the skin becomes more sensitive to touch, making certain types of clothing or even the texture of bed linens uncomfortable. Gentle care, such as using soft fabrics and ensuring they are well supported, can help ease their discomfort. Use a mild moisturizer to keep the skin from becoming dry and cracked. Change clothing and bed linens frequently to maintain hygiene and comfort. So we've explored 5 important signs that may indicate a senior is in their final year of life: unexplained weight loss, persistent fatigue, cognitive changes, changes in breathing, and skin changes. Recognizing these signs can be incredibly difficult, but this awareness allows you to make more informed decisions about care and provide comfort for your loved one in their final year. While it's never easy to accept that someone you love is nearing the end of their journey, facing these signs with an open heart and mind can help both you and your loved one make the most of the time you have left. In these moments, quality is more important than quantity. You can ensure their dignity, comfort, and peace as they transition to a new phase of life, while offering them the love and presence they need. So, if you've noticed these signs in your loved one, please pause and reflect. Don't dismiss these signals. You are not alone on this journey, and your loved one deserves the best care, attention, and love during this stage of their life. Remember, it's never too late to make things better. Sometimes, the most important thing you can give is simply to be present and love them with all your heart. If you are going through this experience, please know that you are not alone, and there is always help and support available to guide you through this challenging time. Please share this video with others who might need it. Hit the like button if you found this video helpful, and don't forget to subscribe to the channel for more meaningful videos. If you have any questions or need support, feel free to comment below. We are always here for you. Be strong and take good care of yourself and your loved ones.